Hello, my name is Brianna Baublitz. I'm a nurse practitioner student, and I'd like to present to you the Lachman test today. So the Lachman test is done to assess knee pain in patients. It's evaluating the laxity of the anterior cruciate ligament, and it's done to be able to diagnose an ACL injury. It does so impressively with 84% specificity, making it a very important test that we know as providers. So an ACL injury is a tearing or sprain of the anterior cruciate ligament. It occurs in about 60 to 80 per 100,000 people every year here in the United States, and it's very common amongst adolescents and pre-adolescents. As patients are active and running around, like I said, commonly in adolescents and pre-adolescents, oftentimes an ACL injury occurs when they come to a sudden stop, if there's a twisting of the leg, and usually there's a bit of a popping sound that is also associated with this injury. Afterwards, it's difficult to bear weight. There's tenderness upon weight bearing, and then there can be some inflammation, redness, and some warmth of the knee joint. So I'd like to now review the Lachman test with you.
So I'm now going to demonstrate for you the Lachman test and walk through a patient scenario. This is Maria. She's my patient today. Maria, can you tell me why you're here?
Well, I was on the soccer field and I twisted my knee and I heard a popping sound.
Oh, ouch. Does it hurt when you walk on it?
Yes.
Okay. Have you tried anything to make it better? Okay. Have you taken any Tylenol or ibuprofen at all?
No.
Okay. And this happened yesterday, you said?
Yes.
Okay. Awesome. Okay. Well, let's take a look at your knee. We're going to do what's called the Lachman test. And I'd like to show you what we're looking at, okay? So I'm going to hold this, and we'll hold it so that our audience can see as well. So you have a tibia, which is right here. That's the bone down here. And then you also have a femur, which is the bone up here. So close, huh? And this is your patella, so that's right here, okay? So you have your femur, tibia, femur, tibia. And connecting the femur and tibia are these little white things. You see those? Mm-hmm. Those are called ligaments. Ligaments connect bone to bone, and they allow your joint to move as well. And your anterior cruciate ligament is what I'm a little bit concerned about, and that's this ligament right here. So we want to make sure that your tibia doesn't move from your femur, okay? So let's have you lay down, and we'll go ahead and demonstrate the Lachman. So I'm going to be comparing both knees for Maria today. I'm looking to see if there's any swelling, any pain, and any tenderness when I touch you. Does it hurt?
No.
Okay. Do you have any, I don't see any redness. I don't feel it warm. I'm going to do the Lachman on both sides because we want to be able to compare both sides. So what I'm going to do is I'm going to go ahead and bend your knee about 20 to 30 degrees. I'm using the outside arm on the outside leg, and I'm bracing the femur, and then I'm going to hold on to the tibia down here, and I'm going to do an upward movement with the tibia to see if there's any laxity in that ligament. So we're going to go like that, and I don't see any laxity, which is great. And then we'll do the same thing on this side. So again, we'll bend about 20 to 30 degrees, outside arm to outside leg here on the femur, holding it and bracing it. And then I didn't mention this before, but you do want to move the knee out just a little bit. Holding onto the tibia, I'm going to lift up, and I don't have any laxity. So again, we're looking like this. Excellent, good job. Your knees look okay. So we would then look at other causes for her knee pain, but that's how you would do a Lachman test.
So when we do the Lachman test, we want to interpret our findings, and we're looking at positive or negative findings. Positive findings are when we can pull the tibia forward, and we classify that as mild, moderate, or severe based on the degree and the amount of pull. And then we're also looking at the endpoint. Is it a soft endpoint, meaning you can continually pull that tibia forward and you can feel a bit of softness in between the tibia and the femur, or is it a hard endpoint? That ligament is holding it nice and snug there, and there's definitely, when you pull it forward, a stopping point and no gap in between. If we have a positive Lachman, then we want to apply a brace to the knee, we want to offer good pain management, and then refer these kiddos to an orthopedist or to a physical therapist. It's controversial whether or not we order an x-ray or an MRI right away because we know the risks of imaging for kids. So the strongest recommendation is to just go ahead and refer to an orthopedist. Thank you so much for your time. I hope you enjoyed my presentation, and I look forward to your comments below.